Hi everyone, it's me again. I'm Lena and I'm from the Healthcare Landscape group. In this video, I'll be talking about my main video, which is about how numerical data is used in healthcare. Now, in this video, I'll be talking about three main parts. Firstly, I'm going to talk about what is numerical data, then I'm going to talk about the components of a treatment plan, and lastly, I'm going to be discussing about how is numerical data used in healthcare. So let's get started with our first part, which is what is numerical data? Well, numerical data, as its name suggests, is data that is expressed in numbers, hence the name numerical. So that's the root word for numerical data. Sometimes it is called quantitative data as well. Numerical data has another name, which is quantitative data, and the numerical data can be represented can represent counts or measurements that can be mathematically calculated, analyzed, and compared. There are two main types of numerical data, which is discrete numerical data and continuous numerical data, which I will further elaborate in my second DE. So that is, firstly, what is numerical data? For the second part, I'm going to talk about the components of a treatment plan. Well, a treatment plan has four main parts: the data collection, analysis, intervention, and also monitoring progress. So those are the steps to execute a treatment plan. Firstly is data collection. So what is data collection in the terms of making a treatment plan? Well, for this part, I need to gather all the vital signs, the lab tests, as well as imaging reports. So that is the first part of a treatment plan. The next part is analysis. So analysis is further comparing current numerical data to past results and normal ranges and correlating them with visual finds from scans. So that is analysis. Analysis means that you compare the lab results of this age from this date to this date. So that is analysis. Analyze the data, the imaging. The next part is intervention, which means that we look at those findings, look at that analysis, and then based on that and make a plan, a treatment plan, a specific plan like medication changes, lifestyle adjustments, surgery, or further testing for the patients, so we can interfere with that disease while we can still do it. And that is for intervention. Next is monitoring progress. So for the last part, which is monitoring progress, is that when the plan is implemented, when the treatment plan is implemented, then we will look at a certain amount of time, a period of time, and then we will monitor that patient, how well that patient is doing, and see if that treatment plan is efficient or not, or effective or not. And so that is basically a treatment plan, the integrated data-driven treatment plan. The last part is how is it used in healthcare. Now there are three main uses of numerical data in healthcare. There's monitoring vital signs, read lab results, and visualize the body structure. Now firstly, for monitoring vital signs, we have basically all the vital signs like blood pressure, heart rate, respiratory rate, oxygen saturation, and temperature. So as you can see on the board here, let me show you. So here is basically a picture of the screen. Firstly, there's the heart rate, as you can see from here. There's the blood pressure, the O2 saturation, respiratory rate, vitals record, and there is the O2 saturation waveform, ECG strip, and the waveform, and the respiratory waveform. So for the heart rate, it is usually measured in BPM, which is beats per minute, and normal ranges can typically fall between 60 to 100 beats per minute for resting adults. So as you can see, this number 98 here is the heart rate. Next is the blood pressure. the blood pressure is measured in millimeters of mercury, expressed as a systolic or upper number over diastolic or lower number. For example, 120 over 80 millimeters of mercury. So that is for blood pressure. And as you can see, this is 131 over 88 millimeters of mercury. This is O2 saturation, and O2 saturation means that it is oxygen saturation, and it is measured via a pulse oximeter. This percentage indicates the amount of oxygen the blood is carrying, typically 95% or higher in normal adults. As you can see, this is 93, which is normal. So there's also respiratory rate or respiration rate, and respiratory rate is counted in breaths per minute. And the number of breaths taken per minute for a healthy adult is typically 12 to 16 breaths per minute. So that is for an example of the monitoring vital signs with numerical data. And as you can see, numerical data, this is all numbers. There's 98, 131 over 88, 93, and 22. So this is numerical data expressed and it is used to monitor vital signs of patients. For the next part, so let me stick this right here. The next part is reading lab results. So reading lab results can include a complete blood count, or CBC, which uses numerical data to count the number of blood cells. And there's red blood cells, white blood cells, platelets in the bloodstream. So that is the complete blood count. There's also a metabolic panel, which measures electrolytes, kidney function markers, and glucose levels. So this has to do with your urinary system. So they will measure your urine and your function and the function of your kidney. That is the metabolic panel. Lastly, for the lipid panel, it provides numbers for cholesterol. And the lipid panel helps us to assess cardiovascular risk. So the lipid panel helps us in that way. For the complete blood count, or CBC, it helps us to screen for anemia or infection. So anemia is kind of like a disease, and so that is the uses of CBC and lipid panel. So as you can see here, I have printed a picture of a comprehensive metabolic panel. As you can see, sodium is 136 to 144, and this is considered normal. The liver enzymes, this is the metabolic panel. So remember, this has to do with your urinary system, your kidney functions, electrolytes, things like that. Liver enzymes are injured or inflamed. The blood urea nitrogen is 7 to 29 milligrams, and this is creatine levels. So this is like a metabolic panel. It helps us to measure the electrolytes, kidney function markers, and glucose levels. So that is for the first part, for the second part of reading lab results. And for the last part, finally, for the last part is visualizing the body's structure. Now, as you can see on the board here, I have a picture of a graph, or a picture of how to visualize the body structure. And as you can see, there's this little shapes here, and so basically it is we use X-rays, CT scans, MRI scans, and also ultrasound or sonography to make these pictures. So as for X-rays, we use radiation, and those radiation will bounce off our body, and we will use that to make 2D images of bones and dense structures. So it will go through a certain layer of skin, and then when it hit the dense bone, it will bounce back, and that signal will bounce back to the machine, and it will help us to visualize the body structure. And so the bones and the dense structures within the body that we cannot see. So those are the X-rays. As for the CT scans, it measures the attenuation or absorption of X-rays as they pass tissues. So for example, skin tissues, the CT scans measures the absorption of X-rays through skin and tissue, like liver tissue, stomach, skin, things like that. And so that is for the CT scans. It combines multiple X-ray images to create a detailed cross-sectional, or sometimes called slice, views of the body. The MRI scans, on the other hand, measures signals emitted by water molecules in the tissues when exposed to a magnetic field. So MRI scans, sometimes you see those huge machines where there's an opening in the middle, and then the person has to lie still, and then they will push the person through that machine, and that magnetic field, it has radiation, so it measures signals emitted by water molecules in tissues when exposed to magnetic field. And finally, ultrasound. Ultrasound, or sonography, uses high-frequency sound waves to create real-time images of internal organs, blood flow, and fetuses. So those are how X-rays, CT scans, and MRI scans, as well as sonography or ultrasound scans, can help with visualizing the body structure. As you can see here, this is a picture of the woman's body, and with these CT scans and these scans, we will help them to combine together to make those images. So how exactly do they make those pictures like seen here on the picture here? Well, these scanners combine those data, and they generate 2D images or slices to form a volumetric data set. So in that data set, the body structure is represented as a 3D grid or three-dimensional grid of numerical data called voxels. So those numerical values called voxels are represented in the body structure is represented as voxels. And then each voxel, each 3D grid of numerical data or numerical numbers has a numerical value that corresponds to the tissue property, like attenuation or absorption, and also signal intensity at a specific location, like the X or the Y or the Z coordinate. So that's an overview on how these tissues, how these scans help us to visualize the body structure, as you can see on this image here. So basically, those are how numerical data is used in healthcare, and that also ends the end of my video. I hope that you learned something new from this video, or just review some of the things that you have learned. Thank you for listening to my video, and I hope to see you soon. Goodbye!